today we're going to be talking about Masseter Botox and whether it truly slims your face. So, Ashley, what's your answer? Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm one of your co-hosts, Dr. Smita. I'm down in New Jersey, and I've got Dr. Ashley Amalfi here with me from Rochester. Hi, Ash.
Hi, Smita.
So guys, we are continuing the series on Botox and fillers, and we're really just keeping it short and answering questions that you all have, whether you see it on TikTok, on the internet, a friend tells you about it. We really want to debunk some of these myths and scaries that you sort of hear all over the place. But today we're going to be talking about Masseter Botox and whether it truly slims your face. So, Ashley, what's your answer?
Honestly, it really does.
And it really does, guys.
In some patients, it can be like profound. Like, it can make some major changes to your face if the width of your face is related to how thick this jaw muscle is. So that's pretty amazing, right?
Yeah.
Like, there's no liposuction. It's just a little injection. Every season, and then there you are with a slimmer face.
Exactly. Well, and I think that's isn't that how we figured this out? I think people were getting Botox for TMJ or grinding, and then, and then we're noticing okay, well, they're actually getting slimmer. And it's because you don't have the bulk of that muscle there. Now,
it kind of narrows you.
It narrows it, right? And so I do have to say though, it doesn't happen for everyone right off the bat. I know I injected my masseters and they slimmed down pretty quickly after the first injection, but for some people, especially if you have a robust muscle and you're really suffering from grinding and all of that stuff, it's going to take a little bit longer. So you have to sort of stay on top of it and get multiple, every 3 or 4 months come in, get injected. And then as that muscle shrinks or atrophies, it thins. And that's when you're going to see the slimming. So don't give up on it if it didn't happen right away.
Yeah, I have some people who we've been injecting for years. And if you look at the very first photos I have with them and then the photos of how they look now, I mean, their face, they look like an entirely different person in a very good way. Like, just the proportions of their face are so much less square, So when people are starting to look and they feel like their face is getting really square, a lot of times it's because that jaw muscle is just really making it bottom heavy. And then we go back to that heart shape that you and I were talking about a few episodes back, which is a very youthful shape to the face. And sometimes one or sometimes many injections to the masseters can really, really help slim that jawline. So it's so cool. And it's so easy,
cool.
Right?
It's
so
like
the
easy.
least painful thing ever.
I know. And that you would think it would be painful, right? Because you sort of inject that needle pretty deep. But honestly, it just sort of feels like if you just put your finger on your jaw and push. That's what it feels like. And I know personal experience. So
people are thinking we're going down into the joint, and they think that it's so complicated, and it is literally just this a couple little pokes on each side. And then that's it. It's just, it's not sore, it doesn't bleed. It's nothing.
It's really nothing. And I think there's a couple of nuances. I feel like sometimes people pick up on this stuff and it freaks them out a little bit after the injection. Have you got this? So, there's different parts of the muscle, right? So sometimes, one portion of that muscle might weaken before the other. And so when you bite down, it sticks out weird, especially that posterior deep part. But again, that resolves. So give it the full 2 weeks for your Botox to kick in. And that weird angle that you might be seeing.
You can see it under the skin a little bit. Yeah.
Right, exactly. That 98% of the time comes down. If it doesn't, then you just need a little extra in that portion of the muscle.
And some people need a bigger dose. Some people just have a stronger muscle, and we always start small because we don't want to overdo it, so you can't chew.
Right.
But
but that's important to eat.
Yeah, we start small, and then those are the kind of things that
And
help
we
us know if
build.
you need a little bigger dose.
Exactly. And I think also it's normal for people to have like fatigue when they're chewing initially, right? I mean, I noticed that in
change.
myself. It's a change where if you're eating a steak or something, you might notice like, oh, I'm
Steak.
feeling a little
I hear it.
tired.
Yes.
Yeah.
It's
I'm
a
tired
steak-
from
it's a steak-
chewing.
it's a steak problem.
thing.
Yeah.
It's a steak
Yeah.
problem or like a big piece of chicken problem or something that's chewy.
Yeah.
But again,
Yeah.
that goes away. And then do you ever hear questions about jowling and whether the masseter,
Yes.
once this is slim, it makes your
Does it
jowls
make
worse?
it worse? Yeah. It
Yeah.
doesn't. It doesn't.
It doesn't.
Right?
No. I mean, I think if anything, you've always had this, except you're focused normally back here because you have so much bulk from your muscle that when that's slim, well, then your eye is not focused back here anymore, right? So
You're
it
gonna
goes right
focus
back
in the
to
front.
the center. So it doesn't make anything worse. It's just all stuff that you've had before. Just maybe didn't pay attention to it because you were focused on something else, right? Everything in our face
Yeah.
it's a balance.
Yeah,
But no, it doesn't
absolutely.
make it worse, guys.
No, totally worth doing if that's an area that bothers you or if it's symptomatic. And we've certainly had
Yes.
episodes where we talked about, TMJ or grinding
Mm-hmm.
or clenching and things like that. So, headaches, tension headaches. So this is kind of a game changer. And I have tons of people who just try it and are just kind of curious and get a ton
Mm-hmm.
of relief from it. So it's become a really popular thing in my practice.
Really popular. I 1,000% agree. It's a great
Yeah.
treatment. So if you guys are thinking
It's
about
great.
it, at
It's
least
easy.
come in.
It's fun.
Yeah, come in and talk to
Yeah.
us. All right,
We'll check it
guys.
out. And it
Another
totally
fun
slim your
episode.
face.
Yeah, exactly.
right.
Yeah,
We'll
you
see
get
you
the
next
added
week.
benefit. Bye, guys.